One of the experts we've been able to talk to over the last, it's almost a year now, and that is Dr. Mark Wakefield from MU Healthcare, and he's on the phone with us again to give us an update as far as some of the numbers that I mentioned a little while ago, and what really has caught my attention over the last couple of weeks is how the number of hospitalizations have been dropping. Dr. Wakefield, good morning. How are you?
Good morning. I'm doing great. Thanks for inviting me to share some information with you.
How exciting is it from the doctor and the hospital perspective to see the numbers down? For example, like I said, 23 today, or at least at the end of the reporting time last week, and we'll get an update here probably shortly today. But 23, that follows up last week when there was 17 one day, 18 another day. Boone Countyans hospitalized, and even the overall hospitalizations have been pretty low.
It's very exciting. You know, we're have a sustained decrease in the number of patients being admitted and the number of patients in the hospital and the number of patients in the ICU. And, we're continuously reevaluating our operations in response to that, and there's some hope that we'll return to a more normal operations from the hospital and clinic standpoint as, we've kind of weathered this surge of patients, which has been sustained high numbers for months, but within the capacity of our healthcare system. And so we're looking forward to the potential of fewer sick patients in the hospital.
Is there an explanation as to why the numbers are dropping like they have been?
I think we have, no, I do not. It'd be speculation, but I think we've done a pretty good job of wearing masks, especially in Boone County, following quarantines, and then, just watching the United States as a whole and to a certain degree the world. There tends to be waves of illness, and then we respond, and then the numbers go down, and of course that creates one of the concerns is that we'll relax and we'll have another wave come our way in the near future.
What is happening with testing right now? I'm going to get to vaccinations in a moment, but I'm just curious as to what's happening with testings right now. Is that kind of dropped off also? Are people less likely?
We've definitely had, these are great questions. We definitely had less demand for drive-through testing, and as the weather gets colder and the demand is less, we've shortened our hours. I would like to envision a day where we don't need drive-through testing. We have the capacity within our standard laboratory clinical assessment units that we don't have to rely on a drive-through, but we're still doing a lot of patients and citizens going through the drive-through. So I don't think that's going to happen in the near future, but we're definitely seeing fewer people requesting tests. So I look at the testing in two ways. We have a group of people who are asymptomatic, who are getting tested because of either travel requirements, and that's a newer thing, and it's very important as people start to feel safe traveling again. But to keep it safe, there's a lot of requirements now to get tested, or people having procedures. And we still want to protect our anesthesiologists and operative colleagues when undergoing anesthetic. It's important to know whether someone has COVID because you take universal precautions, but you take special universal precautions when someone has got COVID, or you delay the surgery if it's elective. In that regard, the rate of those asymptomatic people testing positive is slowly decreasing. It still hovers around 5%, which gives us an idea of what the prevalence of the disease in the community is. These are people who could be transmitting infection without knowing it, and again echoes the importance of masking and hand washing and social distancing.
What is the feel for those in the healthcare profession here in this community about the different variants of the virus that we're hearing about elsewhere and how it's in certain states in this country? I haven't heard of any in Missouri yet, but it's got to be something on the radar.
Definitely is. And, the first thing when you hear about mutating virus, our instinct is to assume it's getting worse. But that may not be true. Now, the evidence from the UK is that it's more contagious, or appears to be more contagious, and that's pretty good information. I think people believe that's one of the risks of these variants. But they may not be more lethal. And other viral pandemics often kind of regress to the mean and become less virulent. Now, it may also be that at the beginning of this disease, it was at the mean and it is going to get worse. So that makes people apprehensive. But we have pretty good evidence that the stuff we've done with masking, social distancing helps provide some protection. It took us a while to learn that, and it's still work to get that into our culture. But it does make us apprehensive, but I think we're well prepared. And for one thing, we've learned that we can escalate our position in the hospital. If increasing numbers or more severe cases start developing, we can change our footprint. We can restrict cases very quickly. We can free up resources very quickly. We've done that really in 2 cycles so far at MU Healthcare, and we're comfortable that we can operate at a normal pace right now, and then adapt if we need to.
That's good news. What, real quick, before I ask you about some other advice that you have for us, especially in regard to vaccinations, what is the latest that you've seen? Last week, I saw a couple of articles talking about double masking or paying closer attention to what kind of mask we wear. Do you have any thoughts on that?
I think that's preliminary, but makes sense. I mean, to a certain degree, more is better. That's why the N95s are so sought after. They're just more effective at preventing the flow of particles, aerosolized particles. But, I've done long surgeries in N95s, and it gets it to be a drag. It's not as normal respiration, and I think you have to balance. I will say one thing off the track is that we're not seeing very much flu, so it tells me that one, we may be testing less for it because we're more COVID-centric in our thinking, but the masks are very effective in social distancing and hand washing at preventing the flu, which has been a good thing. We were really nervous about our capacity if we had a double hit of COVID and flu. It could overwhelm the system very easily.
Well, that's all good. Before I let you go, what would you say is coming down in regard to vaccinations and the availability of those and how those will be administered?
Well, the state is very keen on a mass vaccination plan. They're going to tap healthcare systems throughout the state that have demonstrated the ability to do high-throughput vaccination. I believe there's going to be a release of the details this morning from the Missouri Hospital Association, and MU Healthcare is ready to go. We've utilized the football stadium to have a system to vaccinate up to 4,000 people a day. We last week we did community phase 1B tier 1, and we had 2,000 people go through the system. We've done over 12,000 vaccinations at MU Healthcare, so we're just waiting to get the vaccines. And then my advice to citizens and patients is to register on every possible vaccine registry that you're eligible for, because it's a little bit unpredictable where vaccine will come from, and being on multiple places is acceptable. As for MU Healthcare, when you get an invitation, you have a vaccine. Then you should get off of other registries, as an example, so someone else can get that vaccine. And of course, once you have the first dose, both of the approved vaccines require a follow-up booster injection. You got to get the same type, and you got to get it at the same place.
I'm hoping that the trends that we're seeing will continue, and we're not going to have a cycle back up. But I guess we still need to be vigilant and stay the course.
I would echo that, and I'd love to talk to you about something else in a month.
Yeah, I would too. That would sound very good. We'll see where we're at the end of February and see what might be a good topic for conversation. Doctor, I always appreciate your time. Thank you.
You bet. Nice talking with you.
Thank you. Dr. Mark Wakefield from MU Healthcare has been our guest. It's Columbia Morning at KFRU.